Anatomy physiology of the respiratory system. The respiratory system is divided into two main parts: upper respiratory tract, lower respiratory tract. Upper respiratory tract, nasal cavity, pharynx, larynx. Lower respiratory tract, trachea, primary bronchi, lungs. Upper respiratory tract, nose and nasal cavity, filters, warm, humidifiers, air. Pharynx, throat, common passage for air and food. Larynx, voice box, passage of air produces sound, prevent food entry. Epiglottis. This is the structure of the upper respiratory system, that is soft palate, pharynx, epiglottis, larynx. Pharynx is a musculo-membranous tube that connects the nasal and oral cavities to the larynx and esophagus. It is common passage for both air respirations and food digestion. Parts of pharynx, that is nasopharynx, upper part, oropharynx, middle part, laryngopharynx, hypopharynx and lower part. So nasopharynx, upper part, location behind nasal cavity, above soft palate, lined with ciliated epithelium, respiratory type, opening, posterior nares, eustachian tube, equalize ear pressure, contain pharyngeal tonsils, adenoids. Oropharynx, that is middle part, location behind oral cavity from soft palate, epiglottis, passage for air and food, contain palatine tonsil, lingual tonsil, lined with stratified squamous epithelium, protective. Laryngopharynx, hypopharynx, lower part, locations behind larynx extend from epiglottis and cervical cranial 6 vertebra. Communicate with larynx, air passage, esophagus, food passage. Wall of pharynx, that is formed by muscles, constrictor muscles, superior, middle, inferior, push food down, longitudinal muscles, stylopharyngeus, salpingopharyngeus, platopharyngeus, elevate pharynx during swallowing. Blood supply, arteries, branches of external carotid artery, ascending pharyngeal, facial and maxillary. Veins, pharyngeal venous plexus, internal jugular vein. Nerve supply, that is motor, mostly by pharyngeal branches of vagus nerves, that is cranial nerves 10 through pharyngeal plexus, except staphylophryngous supplied by cranial nerves 9. Sensory, that is nasopharynx, cranial nerves 5, oropharynx, cranial nerves 9, glossopharyngeal, laryngopharynx, cranial nerves 10, that is vagus. So function of the pharynx, that is respiration, passage of air from nose, mouth to larynx, digestion, passage of food from mouth to esophagus, swallowing, deglutition, coordinate action of pharyngeal muscles, voice resonance, contribution to speech, protection, tonsil from part of larynx, that is immune defense. Clinical importance: pharyngitis, sore throat due to infection, adenoid hypertrophy, enlargement pharyngeal tonsil in children, mouth breathing, sleep apnea, obstruction at pharyngeal level, cancer of pharynx associated with smoking, alcohol. Now coming into the larynx. The larynx voice box is a hollow cartilaginous structure located in the anterior neck between the pharynx and trachea. It plays a role in a breathing, sound productions and protecting the airway. Location: extend from C3 to C6 vertebra, situated from of the pharynx and above the trachea. Parts of the larynx: cartilages first, single cartilage, thyroid cartilage, large form Adam's apple, cricoid cartilage, ring shaped below thyroid cartilage, epiglottis, leaf shaped flap that prevents food from entering the airway. Another is paired cartilages, that is arytenoid, chroniculi and cuneiform. Second is ligaments and membrane. Thyroid membrane connects thyroid cartilage of hyoid bone. Cricoid ligaments, important in emergency airway procedures. Vocal ligaments, two vocal cords. Vocal folds, two vocal cords responsible for sound productions. False vocal cords, vestibular folds, protective, do not produce sound. Muscles of larynx: intrinsic muscles control vocal cord, open, close, tight or loosens. Example: cricothyroid, tense cords posterior. Cricoarytenoid, lateral. Cricoarytenoid, close cords. Extensing muscles move the larynx up and down during swallowing and speaking. This is the muscles of larynx. Nerve supply: recurrent laryngeal nerves, branches of vagus nerves. Cranial nerve 10 supplies all intrinsic muscles except one. External branch of superior laryngeal nerves supplies cricothyroid muscles. Sensory: above vocal cord, internal branch of superior laryngeal nerves. Below vocal cord, recurrent laryngeal nerves. Blood supply: arteries, superior and inferior laryngeal arteries, branches of superior and inferior thyroid arteries. Vein drain into superior and inferior thyroid veins. Functions of larynx, that is air passage, connect pharynx to trachea. Voice productions, phonetation, that is vibrations of vocal cord, produce sound. Protect of airway. Epiglottis, prevent food from entering trachea. Cuff reflex, expel irritants from airway. Assist in breathing, swallowing and pressure regulations, that is Valsalva maneuver. Clinical importance, that is laryngitis, inflammation, hoarseness of voice, vocal cord paralysis, injury to recurrent laryngeal nerves, cricothyrotomy, emergency airway procedures through cricothyroid ligament. Laryngeal cancer linked with smoking, alcohol. Now coming into the epiglottis. Epiglottis is leaf-shaped elastic cartilage covered with mucous membrane located behind the tongue and front of the laryngeal inlet. Its main role is act as a lead of prevent food and liquid from entering the airway, larynx and trachea during swallowing. So this is the structure of epiglottis, that is in open conditions and closed conditions. Now anatomy of epiglottis. Shape, that is leaf or tongue shaped. Position, attached to the thyroid cartilage through thyroepiglottic ligament. Projects upwards behind the tongue. Surface, anterior surface faces tongue and oropharynx. Posterior surface faces laryngeal inlet. Ligaments, thyroepiglottic ligament connect epiglottis to thyroid cartilage. Hypoepiglottic ligament connects epiglottis to hyoid bone. Glossoepiglottic folds connect epiglottis to tongue from vallicula. Histology, made of elastic cartilage, flexible, allow bending, covered by stratified squamous epithelium and respiratory epithelium, ciliated columnar on lower part. Blood supply, that is artery from superior laryngeal artery, branch of superior thyroid artery. Vein, drain into the superior laryngeal vein, internal jugular vein. Nerve supply of epiglottis, that is sensory, internal branch of superior laryngeal nerves, branch of vagus nerves, cranial nerve 10. This nerve mediates the cough reflex when something touches the epiglottis. Function of epiglottis: airway protections. During swallowing, epiglottis bends backward, cover laryngeal inlet, direct food into esophagus, prevent aspirations of food and liquids. Respirations: stay upright during breathing, keeps airway open. Speech and resources: helps in articulations of some sound, contribute to resonance. So clinical importance, that is epiglottitis. Acute inflammations of epiglottitis, often due to Haemophilus influenza type B. Symptoms: sore throat, fever, drooling, stridor, difficulty breathing. Emergency: may obstruct airway. Aspirations in epiglottis fails to close, food and liquid enters into the airway, coughing and choking. Cancer of epiglottis can occur in laryngeal cancer. Now coming into the parts of the lower respiratory system. So this is the parts of the lower respiratory system. Respiratory bronchioles, alveolar ducts, alveoli, trachea, bronchus and bronchioles. Now coming into the trachea. Trachea, windpipe, tube about 10 to 12 centimeter long, 2 to 3 centimeter wide, made of C-shaped hyaline cartilage rings, open posteriorly, lined with ciliated columnar epithelium, traps and clears dust, mucociliary escalator. Bifurcates at carina, that is into the right and left bronchi. Now coming into the bronchi, right main bronchus, shorter, wider, more vertical, common site for foreign body aspirations. Left main bronchus, longer, narrower, more horizontal. Each bronchus enters into the lung at the hilum. Bronchial tree, primary bronchi secondary bronchi, 3 in right, 2 in left, tertiary segmental bronchi. These branches further into the smaller bronchioles. Now bronchioles, no cartilage walls made of smooth muscles, regulate air flow by constrictions, dilations, affect by sympathetic and parasympathetic nerves, and as terminal bronchioles further branch into the respiratory bronchioles. Now alveolar ducts and alveoli, respiratory bronchioles, alveolar ducts, alveolar sacs, alveoli, alveoli, that is tiny air sac, 300 to 400 millions in both lungs, surrounded by capillary site of gas exchange. Lungs. Right lungs, 3 lobes, superior, middle, inferior, separated by oblique and horizontal fissures. Left lung, 2 lobes, superior, inferior, with oblique fissure and cardiac notch. Hilum, entry exit point for bronchi, pulmonary vessels, nerves and lymphatic. Pleura, each lungs covered by visceral pleura, thoracic cavity lined by parietal pleura. So this is the structure of the lungs. Right side, left side, superior lobe, middle lobe, inferior lobe, and left side is superior lobe, inferior lobe. So 3 lobes in the right side and 2 lobes into the left side. Functions of the lower respiratory system: conduction of the air, trachea and bronchi transport air to lungs, air filtrations and humidification, cilia and mucus trap foreign particles. Gas exchange occurs at alveoli capillary membrane, regulations of airflow, bronchioles adjust airway resistance, voice productions indirect with larynx. Now clinical importance, that is asthma, bronchoconstrictions of bronchioles, chronic bronchitis, inflammation, excess mucus, pneumonia, infections in alveoli, pulmonary embolisms, blood clot, blocking pulmonary vessels, lung cancer often start in bronchi. Now coming into the pleura. What is pleura? This is the structure of the pleura. It is divided into 2, visceral pleura and parietal pleura. Now, and in between there is the intrapleural space, that is pleural cavity. Now what is pleura? The pleura is a double layered serous membrane that surround each lung and lines the thoracic cavity. It reduces friction, helps in a smooth movement of lungs during breathing, and maintain negative pressure for lung expansion. Now parts of the pleura: visceral pleura, inner layer closely attached to the surface of lungs including fissure, covers each lobe and dips into the fissure, cannot be separated from lung tissue. Parietal pleura, outer layer lines the thoracic cavity, divide into regions, that is costal pleura, lines ribs and intercostal space. Diaphragmatic pleura covers diaphragms. Mediastinal pleura lines mediastinum around heart and great vessels. Cervical pleura, that is extend into the root of neck above first rib. Pleural cavity: between the two layers of the pleural cavity, between the two layers is the pleural cavity, a narrow space filled with pleural fluid, that is serous fluid. Function: reduce frictions during the breathing, provide surface tension, keep lungs inflated against thoracic wall, act as lubricant from smooth sliding. So blood supply of the pleura, visceral pleura supplied by bronchial arteries, venous drainage through pulmonary veins, parietal pleura supplied by intercostal, internal thoracic and superior phrenic nerves. So nerve supplies in the pleura, visceral pleura, autonomic nerves from pulmonary plexus, insensitive to pain, parietal pleura, sensitive to pain, pressure and touch, costal pleura, intercostal nerves, diaphragmatic pleura, phrenic nerves, mediastinal pleura, phrenic nerves. So clinical importance, pleural effusions, to excess fluid into the pleural cavity, pleuritis, inflammation causes in painful breathing, pneumothorax, air in pleural cavity can collapse lungs, hemothorax, blood in pleural cavity. Now coming into the diaphragm is dome shaped musculo tendinous sheet that separates the thoracic cavity from the abdominal cavity. It is the primary muscles of respiration. So this is the structure of diaphragm. It is just below the lungs and above the abdomen. Now parts, that is central tendon, strong aponeurotic center where muscles fibers insert. Muscular parts arise from three origins: sternal part from posterior surface of xiphoid process, costal part from lower six ribs and their costal cartilage, lumbar part from lumbar vertebra through right and left crura and arcuate ligaments. Now opening of the diaphragm important for passage of structures, that is caval opening, that is T8 inferior vena cava, right phrenic nerves, esophageal hiatus, that is thoracic 10 esophagus vagus nerves, aortic hiatus, thoracic 12 aorta, thoracic duct and azogenous vein. So these are the opening, that is vena cava passage, esophagus passaging and aorta passage. So this is the structure of the passage into the diaphragm. Now nerve supply, motor phrenic nerves, that is cranial C3, C5 and C3, 4, 5 keep the diaphragm alive. Another is sensory, central part phrenic nerves, peripheral part lower intercostal. Blood supply, arteries, pericardicophrenic, musculophrenic, branches of internal thoracic, inferior phrenic, intercostal arteries, vein drain into the brachiocephalic, azogus and inferior vena cava. Physiology, functions, respirations, inspirations, contracts, flattens, increase thoracic volume, lungs expand, air in, expiration, relax, dome shape, decrease thoracic volume, air out. Other roles helps in coughing, sneezing, vomiting, defecations, childbirth, increasing intra-abdominal pressure, assist in venous return to the heart, thoraco-abdominal pumps. Clinical importance, diaphragmatic paralysis, injury to phrenic nerves, difficulty in breathing, congenital diaphragmatic hernia, abdominal organs enter thoracic cavity, hiatus hernia, stomach pushes up through esophagus hiatus, hiccups, involuntary constrictions of the diaphragm. Thank you. Please like and subscribe my channel.